One of the things we could consider is little alerts when perhaps clinical management doesn't look as good as it could be. So what we create is a concept inside EMIS that says, hey, this person's had at least 2 Ventolins the past 3 months. We could decide what sort of levels. If that is the case, it can then check to see, are they on some form of preventer? If they are on a preventer, it checks, well, hang on, are they on a combination inhaler? If they are, it can suggest maybe MART regime. If they're on a steroid alone, it can suggest that they should be possibly pushed up in terms of preventer management. If you've got somebody who's on 2 Ventolin, no preventers, we can have perhaps a fairly sort of heavy going message saying, hey, this is quite dangerous. So this patient is little mini mouse, and if we look at their medication list, is that they're on Ventolin on their repeat. They've had a couple of Ventolins recently. They're not on any preventers, so what that happens here is it follows a path down through the protocol, and it says, hey, 2 Ventolins, no preventer, relying on Ventolin alone, without preventer, potentially very dangerous. We can give people links to the gene there. If we were to give mouse, say, a clenil inhaler, and we say, right, let's put you on a regular preventer, what this will recognise now when we test this is that whilst mouse is on a steroid preventer, it's a steroid alone, it's not a combination inhaler. So it'll say you can hover over that and say consider stepping up asthma preventer management, 2 more Ventolin recently and currently not combination. If we were to change that clenil then to something like say Foster, which is the one we tend to use most, and Nexthaler, because we want the dry powder inhaler, not the pump. And we're going to say, right, let's put you on Nexthaler. We'll put that on repeat, and we'll replace that because, we'll replace that because we'll improve change strength, and we'll say we'll just put issue later for now. When I now go back into the protocol and test it, it recognises that this person's on a preventer, but it's also saying that it's on combination preventer. But it's picking up that there's been a couple of Ventolins fairly recent, and they're saying, well, do we need to consider a MART regime on the combination, but 2 more Ventolin recent? Now, we can have that. If practices want that, it can flag up so that perhaps when we're seeing patients that aren't as well managed as they could be, it'll flag up for them and suggest maybe a step up to a steroid preventer, a combination preventer, or MART regime. The other thing we can do is we can adjust our chronic disease template so there's a section that highlights when they're having their review that a patient probably does need their asthma regime managed a little bit more aggressively if they are using quite a lot of Ventolin. For this, I've marked it as 2 Ventolin in the past 3 months. Part of the reason for that is if we say 3 Ventolin or more in the last year, or 4 Ventolin or more in the last year, when we change patients, it'll still flag up that they've had 4 Ventolins the last year if they've been having frequently for quite a few months. So what we found is we might say, okay, let's escalate management, let's put somebody on MART regime, and the alert saying they're still using a lot of Ventolin is flagging for 6 months still, because it's counting the Ventolins they've had up to now, even if they start reducing the use of their Ventolin. So there's a little bit of a need to look at that. But it's an idea in terms of an intervention we can put in that would then stay in the system for practices to try and avoid having these patients long term.